I will be discussing the medical journey to understanding the opioid crisis, going over the changes in medical professions aimed at assessing pain management to overprescription and misuse of opioid-based medications, which resulted in the current manifestation of the opioid epidemic. I will also provide several hypothetical solutions to solving the epidemic. Around 1898, opium and heroin became a wonder drug amongst society up until 1924 when heroin became illegal. According to the PBS opioid epidemic field, the central focus of opioid-based medication is to improve pain management for the elderly, HIV patients, and cancer patients, which has led to advancements in opium-based medication. Opioids were introduced into medical administration during the year of 1990 after doctors considered pain to be the fifth vital sign in administering pain management. Later in 1996, Purdue Pharma introduced oxytocin, which led to a rapid campaign of marketing between pharmaceuticals competing with new opioid-based medication. The result of competing pharmaceuticals during this time period, a lot of unethical marketing has misled the medical community and public about opioid-based drugs as they claim them to be non-addictive. 2007, Manuel Falkery explained that Purdue Pharma pleaded guilty in 2007 to misleading information about harmful medications. Here on out, we've seen a rapid change in opioid-based marketing and prevention. Around 2015, the medical community began noticing there was a large issue with overprescribing of opioid-based medication and issues with treating pain and avoiding addiction. Patients are becoming pill-locked where they cannot attain a normal lifestyle without physical and psychological dependence on taking this medication. Due to the aggressive nature of prescribing opioids, it has created an epidemic. According to Suzuki, long-term use of opioids can lead to one of the hardest addictions to break, as it produces an addictive euphoria that alters the chemical makeup of the brain. The effects produced in the brain by oxycodone and hydrocodone are indistinguishable from the effects produced by heroin. As we see, the substance abuse DSM-5 states that recurrent legal problems are the effects of substance abuse disorder. 92,000 people in the U.S. had died from drug-involved overdoses in 2020, which included illicit drugs and prescription opioids. Lack of awareness to dependence and addiction has been a huge contribution towards the epidemic, and according to the PBS opioid epidemic field, since 1999, sales of prescription painkillers have quadrupled. Combating opioid addiction can be achieved by directing our society into a culture of care, and according to Manal Fakhari, Birch 2022 mentions that restructuring the dosage of opioid-based medication and monitoring doctors and prescriptions can better ensure control of the epidemic as well. Solutions and alternatives such as Sherman and Basaga mentions, chiropractic and massage therapy have been used by the largest fractions of respondents with lower back pain. And also limiting the prescription of opioids to a weekly basis can better ensure the control and monitoring of each patient. In addition, with new prevention and awareness campaigns, deterring individuals from opioid-based medication and to seek alternative treatment would be a better solution. Overall, with greater focus on prevention, marketing, and awareness of the dangers of opioid-based addiction and abuse disorder, we can formulate new alternative treatments and medicines that can better direct pain management for everyone. In addition to programs and services to help those suffering from opioid abuse addiction, we can formulate a greater society of care and